Welcome to Caribbean Focus. Caribbean Focus is the community voice of the Caribbean Research Center at Medgar Evers College, the weekly radio program highlighting Caribbean educational, cultural, and social affairs is on WNYE 91.5 FM, and we're streaming live on Facebook at Caribbean Focus CF. I am your host, Hermina Marcellin, and joining us today is Dr. Christina Pardo, a Haitian American physician with a dual medical doctor and Master of Public Health degree. Pardo's active involvement in social and disparity issues in underserved community was the impetus to her co-founding the Global Women's Health Program and servicing as the Vice Chair of Quality Improvement and Innovation and the Deputy Director of a nonprofit organization, Life of Hope. Welcome, Dr. Pardo to Caribbean, Dr. Pedro to Caribbean Focus. Welcome, Pardo.
Thank you so
Welcome.
much. Thank you for having me, and thank you for this great work that you're doing. I just have the voice for the community, so thank you, and happy to be here.
Thank you so much for joining us here on Caribbean Focus. Um, what has been your greatest influence in choosing your career path as a physician and more specifically obstetrics and gynecology?
So I will say, so first, motivating factor for before I even decided I wanted to be a physician, is I wanted to give back to my country. My family is from Haiti, and finding how I can use my skills, my trade to be able to do that. It's just so worked out that in healthcare, being a physician was my specific, I guess, skill that or strength for me to follow. And it really just kind of, that's something I use to be able to contribute to my country, to our community here. And actually interesting, I always wanted to be a surgeon. But when I went to medical school and I knew I wanted to do public health, obstetrics and gynecology, I felt was a great way to be able to take care of community, take care of women, and also take care of people at a community and even a global level.
You are in the business of healthcare, Dr. Pardo, which has always been of great importance, and that is in addressing health and wellness. As an American Haitian woman, how important is diversity in the business of healthcare?
I apologize, the work doesn't end.
That's okay. That's okay. And again, I'm so thankful that you're able to join us here at Caribbean Focus. I know you have a lot going on.
Yes, thank you. Apologize for that.
That's okay. Do you want me to repeat the question?
Yes, please.
Okay, so as I mentioned, you are in the business of healthcare, and that has always been of great importance in addressing health and wellness. As an American Haitian woman, how important is diversity in the business of healthcare?
So, of course, we know on the news we're seeing the disparities that are there, meaning the differences in health and health outcomes for Black people compared to white people, Hispanic people compared to white people. And we know the many contributors to that, including discrimination and racism. So diversity and inclusion is extremely important. If we want to take better care of our communities, we need people that are from the communities that are taking care, treating the community, and also helping to decide what's best for the community. So until we have more people that look like us, that are physicians, that nurses, everything in healthcare, until there are more people that look like us, that are deciding on policy and everything else, we're not going to see improvement. So it is key to making sure that our communities have access and are able to live healthier lives.
It is indeed key, Dr. Pardo. You are the co-founder of the Global Women's Health Program, and you serve as the Vice Chair of Quality Improvement and Innovation, and you are also the Deputy Director of Life and Hope, as stated in the introduction. May you elaborate a little bit more, first on quality improvement and innovation? Could you elaborate more and on what that entails?
Sure. So as I said, my mission, my vision was always to see how can I help communities? How can I help people, like us that may not have the same access as we do? And so over my career, part of that was to work on health disparities and equity, making sure our communities have everything that they need. And so I've been fortunate to bring in that concept, equity, bring in community into healthcare. And so that's what I do. We have a division of health equity where I work, at SUNY Downstate in my department. And so that's part of my role, is bringing equity to the women that we serve, bringing equity within the community. And one of the ways I think is important to do that is through quality, improving the quality of care that we provide to women and doing it in innovative ways, meaning bringing in the voice of women directly into our department, bringing community-based organizations to help us to see how we can do things better. And that's, kind of like a summary of what I do.
Moving on to your organization, Life of Hope, why the name Life of Hope, and what is your role as a director and the organization on the whole?
Sure. So Life of Hope is a community-based organization here in East Flatbush, New York, and whose mission is really to empower, educate, and bring equity to youth and immigrant families. Obviously, here in Centerbrook, we have Laura, we are either immigrants or children of immigrants, most of us. And so that's, part of our focus. And it was, co-founded by two brothers that were originally from Haiti. And again, to bring hope to communities. So when people are arriving from other countries, to help them to navigate the system, to help them to be able to realize their dream that many people came here for. And so that's, really the origin of it. And I'm fortunate to be a part of the organization on the board and also deputy Dorothy, because it's very much aligned to my vision. As I said, my goal was always to help people from where my family hails from, and by extension, others like it. Immigrant communities have always been my focus. So really fortunate to help kind of drive the vision and mission of the organization at the community. So I get to kind of really do both sides of it within the hospital and within the community also.
And recently, Governor Kathy visited your organization. What was the reason for her visit, and in what capacity is your organization involved?
Sure. So we, yes, fortunate, we had hosted Governor Kathy Hochul on Tuesday as she announced her Vax to School campaign. And I guess the reason why she was here is we actually host one of their vaccine pods. We host their COVID-19 vaccine pod here every Thursday. So we're one of their sites. And then obviously knowing the work that we do to bring equity to our communities, they decided to host that press conference and announcement here.
And again, in alignment with your commitment to serving the undeserved and immigrant populations, which actually led you to your residency at SUNY Downstate Medical Center, right here in Brooklyn, New York. And there you co-founded the Global Women's Health Program. What is the objective of the global approach to women's health?
Sure. The global approach is not much different than the approach, here. It's just knowing how do we apply health in other countries And how do we understand the different contributors and the different barriers to care? So, meaning if we were working in Haiti, what is impacting a woman's health? What is creating barriers to a woman's health in Haiti? And how do we create programs to reduce those barriers? And so it's the same thing that we do here, but obviously in different countries, the barriers and the systems are different. And understanding the cultural aspect of it, having a cultural humility of working in different systems and cultures, and navigating through that to provide care. And so then doing that within our institutions here also is kind of education, teaching our students and residents how to work with a cultural humility, how to care for women from different and diverse backgrounds, whether from in this country or from other countries.
You do speak on some of the barriers involved in taking that global approach, and we did endure the pandemic. So, how has the pandemic affect these communities that are in need of quality improvements?
Yeah, there's no easy way to answer that. I mean, as you know, this pandemic affected everybody, but it
Yes.
affected, like many other things, certain communities harder because of the barriers within the communities. Maybe they don't have the same healthcare institutions, they don't have the same markets, they don't have the same resiliency as other communities. But then also, for our immigrant communities, maybe they have language barrier, maybe they don't know the system as well, and also the type of work that they do. So while many people were able to stay home, our communities weren't able to stay home because of the type of work that they do, and then obviously the risk that can come with that. And lastly, also the benefits that were kind of came down the pipeline. A lot of immigrant communities weren't eligible for many of them. And that's actually something that Life of Hope did, is they actually were part of the mayor's cash relief program to provide relief to communities that were not eligible from some of the things that the federal government did to people, to help people impacted by COVID.
You mention over again equity. What exactly do you mean when you say quality improvement, and how does that connect with the idea of equity?
So equity means that any one person or community has all that they need to live healthy and positive lives. And so quality in as it relates to hospital and healthcare, that is making sure that is for, I guess, for women's health, that women have access to all that they need to have a safe and healthy pregnancy. So within the hospital, making sure that the resources and everything is adequate enough to make sure that we reduce discrimination or racism that may exist, to make sure that we are able to refer women to resources and needs that they may need in the community. So, example, I may be taking care of somebody's pregnancy, but they may have a housing instability. They don't have a place to live. That is important for her to have a safe pregnancy. So making sure that we are aware of that and can provide access to their needs within their pregnancy as well. And so those are kind of examples of, again, providing equity. Again, the patient's voice, allowing the patient to be able to say their needs, their experience within childbirth, and then us within the hospital knowing their experience and how we can improvement if it's needed, if they had a negative experience. So these are, some of the examples in which we merge equity and quality improvement.
I want to zoom in on what you mentioned on reducing discrimination and racism. Here at Medgar Evers College, there's a large Haitian population at the school, which directly reflects the diversity of the surrounding community, and the diaspora on the whole. There are recent images that have been put forth by major networks and social media platforms on the ongoing migrant crisis of Haitians in Del Rio, Texas. Can you speak on the current humanitarian crisis happening in Texas?
Yeah, so first, at first I'd like to say it's quite traumatizing, so everybody that's listening and watching, when we watch those images, it is triggering and traumatizing to watch what is occurring there and the level of indignity towards people. And so for those of us that are Haitian, friends of Haitian, know kind of the Haitian history and background, it's also not surprising, because I think one of the things I said is that, Haitians are subject to a level of indignity that others are not, it seems, and recurs over and over and over again throughout history. We have many examples of it, of the stigma. There was the HIV/AIDS, there was the quote unquote boat people, and really portraying Haitians, in a certain way, and then the discrimination that follows after that. And I feel as though that was a perfect example of what we've seen, and even the response to it. I think that if these were people from other countries, we wouldn't have seen what we saw. The images and the video that we saw. And on top of it, these are people fleeing from, this has been traumatizing a long time, but this particular summer with gang violence, with the assassination of the president, public health situation, the earthquake, and so to see the response to what has happened is really unacceptable. And again, it is an accumulation of many things. We have acute situations, but many things over a long time, of which many countries, including the United States, have had a part in kind of the situation in Haiti and in this after migration that has happened. And so I think it's a terrible situation, and the response is even worse to what has happened. And these people deserve dignity, and they have the right to apply for asylum. They have the right to see if they qualify for certain immigration standards, and we see that in certain cases, we have allowed these things to happen. We just saw it with Afghanistan. We've seen it with Cuba. And so, these people have a right to dignity, and they have a human right to apply for asylum and certain immigration access that is afforded to other groups.
It is without a doubt that the Haitian people of this Caribbean nation, they are inviolable, they're independent. How is your organization, namely Life of Hope, involved in continuing to supporting Haiti?
So, I hope, again, because of where we are in East Flatbush, and we know East Flatbush is little Caribbean, but it's also little Haiti of New York. So it's the epicenter of the Haitian population in New York, and 90% of our participants are Haitian. And so we are, for many, kind of the first stop once they are in this community to help navigate Haitian immigrants and the larger communities surrounding. And so we help them to navigate the system, provide, citizenship classes, English as a second language, computer classes, everything you need to be able to thrive and to be able to work. We help to navigate. They have children within the system. We have a health program, health support program. And I will say that we've definitely seen increase of people recently arriving from Mexico, from Brazil. We've been experiencing it over the summer.
And you see this influx of those coming in and women specifically, are there like any concerns on your end? I know, as you mentioned, you are involved in supporting, but are there any concerns where, women, especially women, the fact that you're a gynecologist, any concerns?
Yeah, so we actually have a pregnancy program here. I mean, that started, so we have a pregnancy program for Haitian women's birth equity. And the reason that we started this program several months ago is because women born in New York City, it's women born in Haiti that have the highest risk of pregnancy complications.
Hmm.
Excuse me. And that is the reason why we felt that there was a gap in access for those women, gap in access to information, navigation, know all that's available to Haitian women. And that's the reason why we started that program. And then, so having already started that program, we've actually seen women come and enroll from our door pregnant, recently arrived from Mexico, recently arrived from Brazil in their third trimester of pregnancy. And so what you're seeing on TV is real. And what I would love people to understand is that it's not just in Texas. Once they come in, oftentimes maybe they're there and then, or maybe they go and meet family members or people that they may know. So they're coming to New York, they're coming to Florida where we have the Haitian populations, and we're seeing it in real time.
What do you hope could be a resolve?
Of this situation right now, what's happening?
Yes.
Number one, the deportation have to stop. I mean, it's unacceptable to send people back to a country that is not particularly stable, doesn't have a stable government, has an earthquake, has their own crises, that has stated they cannot receive these, they don't have, so I think and then I think the deportation to stop. I think they need to have to provide the basic human rights to those people that are there. Make sure that you have Haitians that are involved. And we saw the unacceptable acts by the Border Patrol. So you need to have Haitian groups and individual organizations that are there to reduce discrimination and make sure that there are people that the Haitians that are there can speak to, and can feel comfortable communicating with. And there needs to be discussions of how those who can be supported, because again, United States and Haiti are very linked together. And the United States has a significant presence in Haiti and has significant input in any outcome that is occurring, whether positive or negative, in Haiti. And Haitians are the second largest Black immigrant group in this community, in this country, and make significant contributions. So the United States have an obligation to the Haitian community and to find an acceptable and dignified way to help those migrants that are there on the border.
And with your organization, to learn and to get more information about your organization, Dr. Pardo, where can the listening and viewing audience?
Sure. So I think I'm trying to see if I had it open. So I will put the link on to our website underneath the Facebook, and I realize this is going to be on the radio as well. And so our website is www.lohnyc.org. And we have, obviously, we are community-based organization. We have a lot of volunteers, students, interns, people that like to work and like I said, want to be involved and help. So, we welcome, everybody, Haitian, not Haitian, Caribbean, wherever that you are. We are, here with the people, and we will, appreciate any way anybody would like to help, whether it's making a donation, whether it's coming and helping us on hand with the people that we have here. And again, I put it, the website is lohnyc.org.
Dr. Christina Pardo, it has been a pleasure having you on Caribbean Focus. And I would very much so like to welcome you again.
Thank you so much. I would love to do that, especially, this is ongoing, situation to provide updates. And also, how the updates on what's going on in our community here, and any way that I can contribute, whether it's through this health topic, you let me know. I'm here for you guys.
Thank you very much, Dr. Pardo, for being a beacon of hope, for your passion, for your commitment, and again for joining me on Caribbean Focus. Thank you very much to my viewing and listening audience for tuning in. This has been Caribbean Focus. See you next time. Be well.